I'm really full. Thanks for dinner. It was really good.
Oh, what's this?
Sorry.
Are you diabetic? I didn't know you had an insulin pump.
No, it's not an insulin pump. It's a PICO dressing.
A PICO dressing? What's
Yeah,
that?
a PICO dressing. Well, let me tell you.
Okay.
What is a PICO dressing? Why do doctors use it? Who is a candidate? And how do you take care of it? A PICO dressing by Smith Nephew is a patient intervention comparison outcome dressing. How does a PICO dressing work? It has a 4-layer design. Top layer has high moisture removal and allows for one-way removal of exudate vapor. Absorbent layer moves exudate away from the wound and initiates evaporation. Airlock layer gives open airflow and allows distribution of negative pressure for the dressing. Silicone contact allows fluid to pass and minimizes pain of removal. A PICO dressing is a single-use negative pressure wound therapy system used for open wounds or closed surgical wounds. It can be used instead of traditional wound vac therapy. Why do doctors use a PICO? It has been repeatedly shown to improve outcomes in literature, case studies, clinical posters, and more. It reduces complications. It's been shown to reduce surgical site complications. Simple application. It has different size dressings with up to 7 days wear time, positive outcomes. The PICO can reduce the risk of surgical site complications and can manage incisions for high-risk patients. It's patient-friendly, canister-free, pocket-sized PICO allows patients to be comfortable. Patients can shower, perform daily activities, and it's cost-effective. It reduces your hospital stay, and you can be discharged on the PICO.
Sponge stick, please. I think this would be a good case for the PICO dressing. Can I get that?
Who is a candidate for a PICO dressing? Patients with open wounds and patients with closed surgical wounds. Patients must fit a criteria. The following pictures are pictures from the Smith Nephew website. This is a PICO system applied 4 days after initial suturing because of skin flap necrosis around the edge of a wound. If the wound is producing less than 300 mL of fluid per week, a PICO can be used. This is a wound after 14 days showing vascularization through the scar. This is a patient who had a PICO applied to a closed surgical wound. This particular patient had a breast reconstruction. It is showing before, during, and after the use of PICO dressing. So how do you take care of a PICO dressing? There's no movement limitations unless prescribed by your doctor. You can shower with a PICO, just push pause, disconnect the pump. Leave the dressing on for 7 days. Your doctor will change the dressing if needed. You can also disconnect from the pump for a short period of time if needed. Just push pause on the battery pack and push play after you're done. How do you take care of a PICO dressing? Follow your user guide that comes with the dressing for pushing pause, disconnecting, and reconnecting your battery pack. As long as you have a green light, your dressing is working. If you have a yellow light, your battery might need changed or the dressing needs changed. If you have any problems, just contact your doctor.
A PICO, yeah.